can I call Sophie Maggs and Amara Williams on stage for their next talk, which is the role of the clinical nurse specialist?
Hi everyone, my name's Amara. I'm one of the clinical nurse specialists. This is my colleague Sophie within FLS in Aneurin Bevan. And we're going to be looking at the important role of the CNS within the fracture liaison service. So this is what we do. Identification. We work with our radiology colleagues to identify FLS patients via the weekly radiology reports, identifying patients over the age of 65 with a fracture. Here we're identifying those patients with fragility fractures of wrist, pelvis, humerus, vertebral fractures, etc. We also receive referrals occasionally through the service of primary and secondary care colleagues. Then on to assessment. During the assessment, we look at patients' diagnostics and risk assessments. We use a variety of tools, FRACs and the NOG guidance to assess patient suitability for treatment. We also assess suitability for onward DEXA referrals, and this is in line with our guidance. We hold face-to-face clinics in which we discuss more complex patients and those requiring specialist treatment. We complete risk assessments for all our FLS patients, including falls assessments, and this is to ensure that they're receiving the most appropriate patient-centred care. Education and awareness then. One of the pivotal roles of FLS is education and awareness for patients. We take the time to discuss osteoporosis and bone health with our patients to ensure that they understand their condition. A patient's understanding and awareness of lifestyle recommendations around diet and exercise, smoking and alcohol are key for us in secondary prevention of fractures and encouraging patients to live a healthy and active life. The treatment phase. Here we initiate treatment for patients as indicated by their diagnosis and assessments. We initiate oral bisphosphonate treatments, which can be done through our virtual clinics. We then hold face-to-face clinics for the administration and management of parenteral treatments, all of which are led and managed by the CNS. So follow-up then. This is to ensure that patients are managing their condition and treatment. We follow patients up at 16 and 52 weeks to ensure that patients feel supported and adherence to treatment is monitored closely. We can review any adherence and management difficulties and provide patients with the appropriate guidance or alternative treatments if indicated. Here we can also identify if any treatment failures have occurred and provide appropriate escalation of treatment if required. These follow-ups are crucial in making every contact count, in which we can revisit lifestyle education and the importance of adherence to treatment. How we do it? So during the delivery, we deliver virtual consultations in our face-to-face clinics. The virtual clinics enable care to be delivered closer to home, which has been very beneficial for our FLS population. During our face-to-face clinics, we provide patients with the education and tools to manage their own condition, and we strive to increase awareness of bone health and lifestyle changes, which will impact overall health and well-being. Our key role is to liaise with other services as necessary to ensure we're providing a holistic approach to patient care. Ownership. It is a CNS-led service. We take ownership of the service and we take great pride in what we do. The development. We have adapted the service to better suit outcomes and to improve care delivery to bone health patients. These changes have improved the efficiency of service and streamlining of the service. Peer education and support has also played a key role in service development and will enable the service to progress further into the future. Management. The CNS take the lead with management of patient caseloads to ensure they receive timely treatment and monitoring. This is heavily supported by our dedicated admin team who work efficiently and play a vital role within the fracture liaison service. Leadership, lastly. The CNS are autonomous practitioners in which we're able to exercise leadership within our clinical and our professional practice. We take leadership of FLS to ensure we are providing an efficient service and achieving prudent healthcare. I'm going to hand over to Sophie.
Thank you. So I wanted to talk to you about the clinical nurse specialist role and the satisfaction and well-being. Being a relatively new service, there have been a few teething problems which we have had to overcome. The things that bring us a sense of satisfaction are working in partnership, so linking with other areas such as outpatient bone health clinic allows us to work with other team members and discuss patient cases, building a wider team within our hospital setting. Networking with other professionals, such as events like today, allows us to share ideas to improve our service, which is vital for a new service. Wider integration. Since I first began in this role, I feel we have started to build links with other teams involved in bone health, such as the orthogeriatric teams, community resource teams, primary care, and outpatient and ward teams. And this is something that we aim to build on going forward. Making every contact count. We utilise our contact with patients through assessments and simply just listening. We make onward referrals to other professionals, such as the bladder and bowel service or ophthalmology. The issues that arise during our consultations may otherwise go unaddressed. The development, a big part of our role is education and awareness of our patients, but that counts for us too. Within our role, development has been key, and having support from our managers and seniors to develop and grow from study days, educational events, and further education such as non-medical prescribing has further added to our scope and increased our job satisfaction. Role evolution. My role within this post has changed significantly since joining. Being able to evolve our role and change parts of the service has played a vital role in our job satisfaction and well-being. This not only benefits us as practitioners, but also has a positive impact on patient care. We hope to be able to evolve our role further to become an even better service in the future. And so, what does a good FLS service look like for us? Well, as with any service, patient feedback, listening to the feedback, is vital to help us grow and improve the service in which we run. We regularly share patient feedback within the team to identify areas of weakness that require strengthening. Compliance. Compliance with a healthy lifestyle and medication to support bone health is a known obstacle when trying to improve bone health. As mentioned by Amara, ensuring timely follow-ups for patients and addressing any barriers to compliance is key in promoting bone health and preventing further fractures. Patient empowerment is a key factor within our role. Often our patients are quite shocked to hear that they have osteoporosis or have high risk factors for the condition, particularly because they cannot see it. Being able to take the time to break things down, educate, and give evidence-based options empowers our patients to take control of their condition and make decisions in their own care. Self-care of a long-term condition enables patients to manage their long-term condition. This is important when trying to create an efficient service. The self-injection programs we run have become increasingly popular with our patients. It gives them the ownership of their own condition and treatment with direct access to specialist nurses when they need it. And ultimately, a good FLS service for us is patients living as long as possible independently with healthy bones. I've put a last slide up. It just gives a visual within our service of the importance of the nurse specialists within the FLS setting. So it just shows when we had no nurses, when there were 7.5 hours a week, 1 whole-time equivalent, and what we can achieve with 2 whole-time equivalent, which would go up with further staffing. Thank you.